but now we're starting to see this shift to improving the performance of the system. What does some of that work look like?
I honestly, like, most of the systems were just beginning to get there. They were working on this foundational stuff. They were working on standardizing the data, standardizing the processes, getting everyone on the same EHR, and only just beginning to. So we have a sense of what they were doing in terms of the adding value. But the emphasis that came across really clearly is most of the health systems, even the more advanced ones in these activities, were telling us that they were just beginning that journey. But I can talk about some of them. I first wanted to mention, though, you mentioned governance. So we didn't include it in this paper just because we didn't have space, but we also learned quite a bit about governance, and also some of one of the kind of early foundational activities is to try to figure out a governance plan. Like, some of these health systems we talked to, they were still just trying to figure out how to make decisions. Like, most decisions were kind of made in an ad hoc. They'd create an ad hoc committee for almost every decision, whereas some were actually pretty far down the line in terms of having very structured processes for governance. So that's a whole other dimension which we didn't even include in this paper, but we're thinking about including in maybe a future paper.